Okay, we just finished talking about technical services and programs, and we are now going to move on to begin looking at how technicians help with pharmacy technical services and programs. So the pharmacy technician plays a very vital role. Pharmacy technicians help with these services by coordinating billing with the patients, insurance companies, scheduling appointments, and taking patient information. And so there must be a coordination of the billing, scheduling appointments with the patient, and this is regards to counseling between the pharmacist and the um, patient, and of course taking patient information. This could be from a physician, a nurse practitioner. It could be from the patient itself in order to determine and match the prescription with the patient. So that is something that's important because then it has to be stored or utilized in order to provide the best care for the patient. There are many different types of regulatory regulations that are associated, and we have talked about all of these already. The Omnibus Budget and Reconciliation Act. We talked about in relationship to giving the pharmacist the ability to consult with the patient and some expanded roles of the pharmacist. The Health Insurance Portability and Accountability Act, which you need to know. This deals with the confidentiality of health information from the patient. The Medicare Prescription Drug Improvement and Modernization Act, or Medicare Part D. This allows for the government to assist in the payment of prescription, combat vitamin epidemic act, dealing with controlled substances, such as ephedrine and pseudoephedrine. Okay, and we will take a look at that in a little bit more detail. So the Omnibus Budget Reconciliation Act occurred in 1990. And this requires community pharmacists to offer Medicaid patient counseling and instructions regarding prescription drug doses, the relevant information, and the duration of the administration. And if there are any special instructions or directions for the taking care of the medication, that can be facilitated between the pharmacist and the patients. Okay, so again, that is involved in empowering the pharmacist to be able to consult with the patient. In 1996, you have the Health Insurance Portability and Accountability Act, which require all healthcare professionals to protect patients' information and privacy. And there are certain practical ways that this can be done, such as never discussing patients outside the pharmacy setting, shorting documents, papers, or labels with patient information instead of describing them in regular class, speaking to patients about patients to other authorized healthcare professionals in the most private area possible, and never discussing patients with any individuals unless the patient has provided written authorization to do so. Okay? And so when you're working as a pharmacy physician, make sure you are aware of that particular type of confidentiality between yourself and the patient. In 2003, you have what's called the Medicare Prescription Drug Improvement and Modernization Act, which provides a drug benefit program to senior citizens. This is also known as Medicare Part D and relies on private prescription plans, or PDP, companies provide coverage to Medicaid eligible individuals. And then in 2005, you have the Combat Methamphetamine Epidemic Act. And this limits the sales of all over-the-counter products in any form that contains methamphetamines, precursors, chemicals such as pseudoephedrine, ephedrine, or phenylpropanolamine. Okay, so many of the cough medicines that contain that, such as those particular medications, and we talked about them previously, are kept in the back. So even though they are over the counter, a individual must ask pharmacists for them. Okay, so even though there's federal regulations, there are also state regulations. So community pharmacies are mostly closely regulated at the state level. Each state has a board of pharmacy that establishes and enforces regulations for the state. For example, many states have mandated OPRA 1990s counseling requirements for all patients, not just those on Medicaid. So what are some of the things that are regulated by the state? The counseling that occurs between the pharmacist and the patient, the person who's picking up the prescription and will be using the prescription for their ailment. Physician technician certifications, such as this program is certified by a state. The amount of pharmacists to pharmacy ratio, that's very important depending on the size of the pharmacy. The state require that there are pharmacy solutions to assist the pharmacist. The scope of pharmacy technician practice, and we talk about the scope of practice, is something that you can't do. For example, you cannot do any counseling. How to go about the record keeping, which is mostly computerized these days. The type of equipment in the pharmacy and the work area that's requirement, and then the scope of medication compounding. All of these are regulated now by the state. Okay, I have several pictures here because organization is very important. And you notice that when you go to the pharmacy, this particular way that each pharmacy, no matter whether it is owned by an individual chain like CVS, like a Walgreens, whether it is within a particular merchandise store, such as Walmart, Kmart, whether it is an individual family-owned or locally owned pharmacy, all has a particular type of configuration associated with it. There is the transition window, as you can see here, in which the patient interacts with the pharmacy technician or the pharmacist, mostly the pharmacy technician. And at this particular transition window, I must state the following: every pharmacy have an area designated for dropping off and picking up prescriptions. Sometimes pharmacies will have a separate counters for intake and dispensing. And so this is in accordance to HIPAA. We just finished talking about this, and this is called a transition window. Storage. Here is an example of the storage area that's found out of sight of the, or even though the patient may see it, out of range of the patient where things are stored. Okay. So storage, there must be adequate shelving, cabinets, and drawers for storage of medication. Medication must be arranged and shelved alphabetically according to their generic name, or they may be arranged according to the brand or trade name. That's an example of storage you can see around here as a person. The next one is the prescription counter. The prescription counter is very, very important. Okay, as you can see here, is an example of a prescription counter. There will be at least one counter designated for preparing non-compounded prescriptions. Equipment used in this area include counting trays, vials, labels, and auxiliary and precautionary labels. This counter should be all kept clean and orderly at all times. And you can see that in this particular picture right here. A lot of times you have a compounded area. So the pharmacy will also include compounded area. This is for prescription required mixing and other preparation. There must be an easily accessible sink in the area and kept clean at all times. Let's see up here. Okay, compounded area. And then here you have what's called prescription bins and shelves. Prescription bins and shelves. Completed prescriptions are generally placed in bins or shelved alphabetically, alphabetized by the customer's last name. So basically, all community pharmacy, you see this type of organization. Okay, so we talked about this transition window for pickup and drop off of prescription. Pharmacy counseling area, very important. Must be private and under the control of HIPAA. We talked about drug storage areas, and there's of course many different things that can be stored. Tablets and capsules, syrups and suspensions, creams, ointments, and other topicals, air, eye and ear drops, rectal and vaginal preparations, injectables, inhalers, and nebulized medication. There must be a locked storage for controlled substances, and of course, for medications that need refrigeration, that needs to be provided. All right, organization, continue. We talked about this. Compounding area. You can see here, this person is at a compounding area, and you see the sink that's nearby. Prescription counters for provision of prescription, as you can see here. And then prescription bins and shelves. You can see the person's and the individual's names being alphabetized. Okay, and this is done basically in all pharmacies. Something that is also very important. Now, it is a business, and also you're dealing with people with unique needs, and that's why they're there. That's why they pick up their prescriptions, all types of something maybe very mundane, a headache, or something more severe, such as pick up their chemotherapeutic medication. But what you need to do, and this is very important, this is a very good picture here to illustrate a very welcoming disposition, a nice smile, explaining the person's medication to the individual. So you want to present yourself in a calm, cautious, professional manner. Listen carefully. Make eye contact. This is part of our culture, eye contact. Repeating what the customer says. Calling patient by their name. Knowing when to involve the pharmacist, and that is something that's important when you go back to the crew. We'll talk about that. Dealing with customers' place. You want to have a positive response versus a negative response. All those things are very, very important. So, something that should be noted here, the health of the customer is a significant factor in their experience with community pharmacies. Customers may often feel sick or irritable and need their medication quickly. Having to wait in line may be physically difficult and emotionally upsetting. The cost of the medication may be an additional worry. Consequently, the customer service is important in any type of retail store, and it is particularly important within the community pharmacy setting. It is important to respond to the patient in a positive manner at all times. In any situation where the customer is angry, frustrated, or otherwise dissatisfied, it is especially important to give a positive response. This can be done in part by listening intently and making eye contact with the customer. Repeating what the customer has said is also important, since it demonstrates that you have listened to their complaint. Use a positive, not negative terms to the